So hello, we're Oscars nominees presenting our topic on what Bob just said, applying two-eyed seeing education. So to begin, Indigenous communities suffer due to traditional Western healthcare failing to provide sensitive services, and the reported health outcomes of these communities reflect such. This is largely due to improper system that does not understand the cultural differences. Due to this, they are unable to effectively provide mental health care. This disconnect in perspective leads to a system that was forced onto indigenous communities but does not have the capacity to care for them in the way that they need.
Okay, first let's begin by actually introducing the concept itself. A two-eyed seeing approach values both indigenous perspectives, which emphasize holistic, relational, and community-based methods, and Western approaches, which focus on evidence-based and analytical practices. In mental health rehabilitation, as we're focusing on, the principle ensures that care is both culturally sensitive and effective, addressing unique needs of indigenous communities and patients. The need for two-eyed seeing is rooted in historical marginalization of indigenous knowledge systems. Colonization brought devastating impacts, including diseases like smallpox and influenza that decimated populations, along with the implementation of residential schools that stripped children of language, culture, and identity. Residential schools created intergenerational trauma, contributing to widespread PTSD, addiction, and poor mental health. Research such as Walls and Whitebeck's study highlights how early life experiences in residential schools are linked to things like PTSD and major depression in adulthood. The effects of colonial policies like the reserve system and the Indian Act also disrupted family structures, eroded cultural continuity, and created systemic barriers to healthcare access. Today, these disparities are evident in high rates of dementia, as we're studying, and chronic diseases in indigenous communities, underscoring the importance of cultural relevant mental health rehabilitation. When analyzing Western healthcare models, while effective in some contexts, oftentimes they fail to address the cultural and spiritual dimensions central to indigenous healing. These systems focus on individual symptoms, neglecting the socio-historical roots of health disparities. For example, Western psychiatry prioritizes institutionalized treatments, which can alienate indigenous patients and fail to provide holistic care. This contributes to mistrust in healthcare system and limits the effectiveness of mental health interventions. So overall, two-eyed seeing offers a solution by integrating traditional and Western approaches. For example, the Well-Variety movement combines the 12 steps with the indigenous medicine wheel to address addiction recovery, blending spiritual and emotional healing with evidence-based practice. In dementia care, elders' wisdom and relational caregiving practices are used alongside biomedical strategies, empowering communities and fostering cultural pride. Land-based healing initiatives, like those in the Minneskin Lake Cree Nation, reconnect individuals with traditional medicine, language, and the environment. These camps combine the teachings of hunting, fishing, and ceremonies with mental health rehabilitation, addressing both the immediate health needs and the deeper cultural healing. Such approaches build trust and create more effective, culturally aligned healthcare solutions. In conclusion, our group's presentation aims to not only address the mental health challenges, but also pushes the need for a Western centric society such as ours to empower Indigenous communities to reclaim their health, cultural identity, and pave the way for full healing and resilience.
So there have been multiple strides in adjusting healthcare to provide better for indigenous communities. One of the major achievements is developing culturally relevant diagnostic tools and care strategies. For example, in Northern Ontario, researchers collaborating with the Anishinaabe utilized two-eyed seeing to recognize the prevalence of dementia and responded with tailored interventions. And incorporating traditional beliefs about the aging process, like viewing dementia as a return to childhood and a natural part of the life cycle. Healthcare providers could offer care that respects cultural norms. This holistic perspective reduced the stigma often associated with dementia in these communities, making it easier for families to seek help and support for their elders. Furthermore, community based participatory research has been a critical component of these efforts, involving Indigenous advisory committees and elders in guiding the studies. For example, instead of using Western focus groups, researchers incorporated traditional sharing circles. This adaptation fostered a safer and more respectful environment for participants to share their experiences, ensuring that insights gained were deeply rooted in Indigenous cultural contexts. Such adaptations have helped in developing training programs for healthcare workers, making them more culturally sensitive to nuances of dementia care in Indigenous settings. These achievements highlight some of the effectiveness of two-eyed seeing in bridging cultural gaps and addressing health disparities in dementia care for Indigenous communities and offering a model that can be adopted for broader health initiatives.
Although many of these triumphs have had great lasting impacts, we still face many challenges as a collective society. Mental health rehabilitation for Indigenous Canadian peoples, they face significant challenges that are still rooted in cultural differences, systemic barriers, and historical inequities. While efforts have been made to improve care, the disconnect between Indigenous worldviews and Western healthcare systems, combined with structural and educational shortcomings, continues to limit our progress as a society. These barriers not only affect access and trust, but also the cultural relevance of mental health services, further perpetuating health disparities. To begin with, a key challenge lies in the contrasting worldviews of Indigenous and Western healthcare systems. Indigenous approaches emphasize holistic well being, integrating mental, emotional, spiritual, and physical health, while Western models focus on disease specific interventions. This fundamental disconnect often leads to care plans that fail to meet the unique needs of Indigenous communities specifically. Compounding this issue is a widespread lack of understanding among healthcare professionals about Indigenous health, beliefs, history, and systemic racism. Misconceptions about traditional healing practices such as smudging or relational caregiving further marginalize Indigenous approaches to caregiving, further labeling as just mental health. These cultural misunderstandings create significant barriers to effective, culturally aligned care. Secondly, systemic inequities further hinder access to mental health services. Many Indigenous communities, especially those in remote lack areas, have faced no healthcare facilities, have no specialists, and resources available to them. Socioeconomic disparities, such as lower education levels and income, make navigating complex healthcare systems even more challenging. Moreover, Indigenous leaders are often excluded from healthcare policy-making progresses, resulting in programs that do not address community-specific needs. Without meaningful representation, policies fail to incorporate culturally tailored approaches, perpetuating inequities and mistrust in healthcare systems. Lastly, bias and discrimination within healthcare systems are critical barriers to mental health rehabilitation. Stereotypes about Indigenous patients, such as assumptions that many of them face substance abuse, often lead to rushed consultations, inadequate referrals, and dismissive care, even. These prejudices erode trust in the healthcare system, discouraging Indigenous people from seeking the care they need. Addressing these issues requires dismantling systemic racism and fostering cultural safety through comprehensive provider training and mindset shifts. However, resistance to such changes remains a major obstacle and a challenge to this day. To sum it up, addressing these challenges is essential to improving cultural competence in healthcare, amplifying Indigenous voices in policymaking, and confronting systemic inequities and biases. By committing to these strategies, mental health rehabilitation for Indigenous peoples can become more equitable, culturally relevant, and effective, fostering trust and supporting holistic healing within Indigenous communities for a more balanced two-eyed seeing health rehabilitation.
Presently, there's an increase in cultural awareness and understanding of Indigenous people's needs in regards to their healthcare. One example of how this is reflected in practice is using the circle of life. I want to stress that this is not a pan-Indigenous concept that doesn't exist, but something that many Indigenous communities might relate to or have a similar idea of within their own community. Through working with Indigenous communities to identify needs in culturally competent healthcare, we're seeing a shift in language used to describe dementia in a way that helps Indigenous people with dementia and their caregivers. This influences the ways that Indigenous people understand the concept of dementia and how to identify it symptomatically. For example, some aspects of dementia that Western culture may consider pathological are considered to be a natural part of the aging process for Indigenous people. So, using descriptors that keep this fact in mind is important to offering quality care. There is an ongoing public health care issue in terms of Indigenous people getting the care that they need. From our keynote study, an approach to improve to improve dementia health literacy in Indigenous communities, The pamphlets for Indigenous people with dementia, created with that in mind, were only given to clinics upon request, meaning that there's gaps in who's receiving this information. Structural racism plays a large role in the development of dementia. While white people are genetically more predisposed to Alzheimer's disease due to mutations of the APOE4 allele, Indigenous people, along with other people of color, are at higher risks of getting Alzheimer's, mainly due to the social determinants of health influenced by structural racism. From the American Alzheimer's Association, less than half of Black and Indigenous people feel that they can access a healthcare provider who understands their racial and ethnic experiences. Connecting Indigenous people with navigators and healthcare providers who understand their experiences is something that needs to happen to improve the patient experience. In summary, two-eyed seeing as a clinical application promotes balanced, culturally respectful healthcare by valuing both holistic and Indigenous approaches and evidence-based Western practices. Healthcare, in general, is often limited in addressing cultural, relational, and historical factors crucial to Indigenous health. Within this, there's emphasis on biomedical models that focus on the disease and not the person. Medication, psychotherapy, and institutional treatments are placed on a pedestal. Colonization cannot be ignored in terms of the impact on Indigenous health. It brought disease spread, displacement, residential schools, and intergenerational trauma. This leaves in its wake a legacy of health disparities, including mental health challenges, chronic diseases, and rising dementia rates. Improving healthcare outcomes would look like the integration of traditional practices such as ceremonies, medicinal plants, and elders' wisdom with Western treatments. Community-led programs support cultural identity, holistic well-being, and empower Indigenous health self-reliance. And the development of culturally relevant diagnostic tools as well as holistic models and adaptations to improve healthcare outcomes.
So finally, in highlighting the benefits of applying two-eyed seeing to Indigenous healthcare, we find it is imperative to use these strategies we've outlined to break down barriers and assist Indigenous people in the most effective way we now know. Cultivating this cultural sensitivity is important, and educating healthcare providers greatly benefits the healthcare outcomes we achieve, and it is crucial to the understanding of another culture so that they can receive the adequate care they deserve. In doing so, we bridge the gap between cultures and understand the differences to break down the barriers between both communities. Thank you.
Well, thanks very much, Oscars nominees. Paul.
Yeah, I was thinking that my dad and his dad lived to be 100 and had all their faculties when they died, but my mother had dementia when she died around 76. But I guess it's not the, I guess when people say this going to residential school seems like that's the problem. It's all the atrocities that took place at residential school that make it an issue. And then also I would say, because we're talking about how knowledge is transferred, is that it broke the chain. The residential school broke the chain, the way knowledge systems, the knowledge was handed down to the kids, to the parent, from the parent. That way, that whole thing, whereas the grandparents used to raise the kids and impart all that knowledge and cultural on them, it got taken over by the residential school. So it kind of broke that chain.
Yeah, I see what you mean when I think of my own non-Indigenous background. The role of not just my parents, but my grandparents and other relatives, family, in sort of what I became, and to think of that all being, abruptly, violently taken away. Yeah, and then what happened when the kids were taken away. Okay, well, thank you for that, Oscars nominees.